Thank you, Mahendra, for the introduction. Thank you for having me. It's a pleasure to be here, and I will try and share some perspectives on AI and what it's doing to the healthcare system, including the current pandemic. I will share with you my screen. One second. And I'll be happy to answer questions afterwards because I cannot see you at the current time when I'm presenting the presentation. But please feel free to jot down your questions or ask them at the end of the session. Okay, as I mentioned, I will be talking a lot about artificial intelligence, what it has and will be doing for the healthcare system, and how it's helping provide a proper healthcare for all populations in all geographies. And that's the most important and passionate thing that I'm helping drive. This has also turned out to be a great toolbox to fight against the current coronavirus pandemic. Before Corona times, a long, long time ago, we spoke about the need for AI in order to enable a proper healthcare for the chronic patients, to be able to bring them personalized medicine, to be able to bring them healthcare to their home, and to be able to provide for a healthier life. But then AI is, and I'm quoting a good friend, Laurent Chappé, is a great solution because it's a convergence between software and engineering, and the vibrant life science ecosystem, especially in Israel. When you merge these two technologies, you get very interesting new fields of life science, like robotics, telemedicine, digital diagnostics, digital therapeutics, regenerative medicine, and more. And it truly is sensational when you look at all the different solutions. And currently in Israel, there's about 1,000 different digital healthcare AI machine learning solutions. So it's really amazing. But then came around the current pandemic, the coronavirus, and it required immediate solutions in remote monitoring and home care, in protection and prevention, in diagnostics and decision support, and also in social and mental, all the social and mental aspects that are connected to this. And with this, Israel, as well as other countries, came to the rescue. But Israel is, I think, even better positioned for coming up with these quick solutions because we have a robust ecosystem in place. And there's, like I said, between 800 and 1,000 currently digital health startups. There's a lot of government support and involvement, and hospitals and HMOs are in full sync, as well as the whole ecosystem. And I'll go into that a little more deeply in this presentation. The ecosystem, as I referred to, it basically consists of all the different players. It's not just hospitals. It's not just the academics. It's not just the startups. It's everything, including private investors, the government, the tech transfer offices, and the entrepreneurs, and everything else, which brings about the reason why in Israel we have thousands of medical technology companies in existence, some early stage, some just getting to market, and several later stage. We can get into discussion on that later, but I would like to focus more on the digital health and the current solutions that we're providing. The secret sauce to this whole thing is everybody participating and contributing, especially the government in a lot of different ways to fund the activity. And as I will mention later, the whole thing is it's great to develop as solutions, but you got to get them to market, and you got to have the right strategic partners to help you get this to market. Lots of great developments, but if you can't get them to market, it's not worth a lot. Israel currently has, I think this is not even up to date, currently has about 200 companies harnessing their technology to combat coronavirus. Like I said, from remote monitoring and home care, social and mental aspects, protection and prevention, and diagnostic and decision support. This picture doesn't depict all of the companies, obviously. It's just a great sample, and this is available online from both Health IL and Startup Nation Central. I can provide a link to this as well, but I'll go through an example of some of these companies. In remote monitoring and home care, there's, I think, the majority of the companies today. The list is much longer than this, but one good example is TytoCare, and TytoCare has developed specific tools to help monitor patients at home and connect them to the clinicians. See here, this is an ear check, there's temperature check, there's throat check, and there's many other accessories to this little camera, which connects virtually to the doctor, and he can do the diagnosis and send the prescription immediately to the pharmacy store, and that would be available for you to go and buy the prescription. This is one great example of a company that's flourished during this time as the coronavirus started. They immediately turned into working with the hospitals, working with the clinicians and the HMOs to be able to provide them with this solution almost immediately. This also, and this is another side effect that's been happening in this field, this also has been the catalyzer for a lot of the latest investments. TytoCare, a couple months ago, just received a $50 million investment from several funds, and there are many more examples like this. Protection and prevention, again, there's several companies on this. One of the ones is SOPI. SOPI is one that obviously started before the coronavirus, but has gained a lot of momentum since. It's about taking care of hand hygiene efficiently, rapidly, and through IoT mechanisms. Again, a great solution that's the right solution at the right time, and they're just skyrocketing with activity as well. Diagnostic and decision support, again, there are many companies out there providing that. One of the examples is Bina. Bina is an AI-powered, video-based health and wellness monitoring. Basically, through the camera of your mobile phone, you can monitor your heart rate variability, your mental stress, your blood pressure, and they've added temperature since coronavirus started, and other symptoms as well. This is a great technology and that I've vetted and looked into it, and it actually works. Another example of a company who is flourishing during this time and has been able to get a big investment as well. As far as social and mental aspects, there are a few companies, but one great example is XR Health. It's a VR-powered telehealth home care type of solution for providing faster recovery from surgery or from any other ailment, and it's an enjoyable and drug-free treatment. Again, I'm not getting specifically into these technologies, and there's a lot we can talk about in each one of these, but they're definitely providing solutions, and you're seeing the need, and in this space especially, rehabilitation has just taken off and skyrocketed in this time of the coronavirus. The critical pillars to be able to provide such a robust ecosystem all starts with the government, and a government that really wants to help, and officials that have significant industrial innovation experience that understand the challenges, meaning it's not enough to pour money into the system. You got to understand the challenges and the goals these entrepreneurs are going through as well. It also requires private and public collaboration, as well as hospital and other clinician type involvement. The main players in Israel obviously include the Ministry of Health, but we also have NGOs such as Health IL, which is the digital health community, driving challenge-centric approach solutions. We have ARC, we have Biohouse, and we have many other groups like that basically pool together the knowledge and bringing solutions to the market. The digital healthcare landscape, again, this is not an up-to-date slide. There's close to, like I said, between 800 and 1,000 digital healthcare companies in Israel today. And some are under the radar, so they're still not counted, but I see them on a daily basis. through my activity of mentoring, supporting, consulting these companies. And they're varied in different sectors: clinical workflow, diagnostics, patient engagement, assistant services, digital therapeutics, remote monitoring, decision support, and more. So it basically provides the whole need from home through hospital, through rehabilitation center, and others. Again, these infograms are available online, and they don't include all of the companies, obviously, for lack of room and fitting all of this in one infogram. There's a vibrant brain tech solution ecosystem here. There's a vibrant cardiology and healthcare system, patient system. Again, I won't go into all of these technologies, but some of them are very cool and next wave. And this is what's going to enable personalized medicine. This is what's going to enable proper pharmaceutical development. This is what's going to shorten time to market of a lot of technologies and a lot of drugs. The problem, as I mentioned before, is for these companies is expanding internationally. Most companies lack a operational strategy, and they lack distribution networks, and they don't do enough clinical validation in the geographies themselves, and most of them need funding to be able to expand their activities. So one of the things I've been working on is how do we scale this globally, but also on a practical level, not theoretical level. Working with different geographies to be able to do clinical validation, to be able to tap into data centers where there's actual patient data stored for many years. In Israel, we have the patient data stored for probably the last 30 years. In Taiwan, they also have something similar, 25, 30 years of patient data. Tapping into centers like in the US, in Boston, and looking to tap into centers in India to be able to do cross collaboration with different centers. This is just an example of few geographies, but it's actually working right now. As an example, I'm running a program for 25 companies in Taiwan where we're taking them in there, having them do clinical validation with local partners, having them match up with strategic partners for distribution, and having them match up with investors to be able to fund all that for Far East activities. Something I'm looking for doing in India as well, and looking for the right partner to be able to do that. So anyone interested, please reach out to me on that respect. As I mentioned, investors are needed, but again, each company has to map out their financial roadmap, which kind of investors they need for which stage. Not all companies are equal. Not all investments are equal. And the big corporates play a great role in this because they're at the end of the day, they're most of the time they're the end users, or they can enable the end users to use this. So always looking for great partnerships. A little bit about myself. I'm an engineer in my training. I've been in this a medical technology business for a long time. A Healthier Globe is a consulting company helping companies go to market. And I do a lot of mentoring and boot camping around the world, different acceleration programs. These are just a few. And basically helping companies go to market on a global basis, not just in Israel. Been involved in two companies where they grew from $0 to $100 million. Second one we took public. We spun off a technology, and then we ended up getting sold to Covidian, which is now Medtronic, for $350 million. And Medtronic shortly thereafter bought Covidian for $52 billion. As I mentioned today, I head up a global network of professionals which are assisting and accelerating early stage companies and creating go-to-market strategies. And basically, there's a process to the madness. I won't go through this as well because I want to leave some time for questions. But there's 24 steps to helping companies get to market. The first half of the clock, from 12 o'clock to 6 o'clock, is the product development, and the second half is the market development. And looking at where each company is at each one of these stages basically helps create value for the companies. It helps them get all the pieces of the puzzle put together, and it helps them get the funding they need to be able to get to market. AI is definitely here to stay. Past the corona time, this will enable us, as I mentioned, to provide personalized medicine in the near future. What coronavirus has done is it's accelerated the process of bringing some of these technologies to market from years to months to weeks even. And it's a great incentive to get healthcare provided for all geographies, even in rural geographies where proper healthcare was not provided before. And that is my vision and passion, and that's what I'm going after, looking for the right partners to do that. I thank you at this stage, and these are my contact details. I would, at this stage, open this up for questions, but I need to stop sharing. 1 second. Okay, I've been involved with the India market for several years now. The challenges I see to bring this to market is to find the proper partners to help take this to market, to find the proper business model because it's a cost-conscious market, and to be able to and to be able to provide the healthcare providers the proper solution. So really need to customize the solution for India, both on price point and both on solution provided and finding the proper partnerships to go to market. Sorry, which AI solutions are used for? Okay, so all of these ones that I've mentioned, all the 200 companies, I showed some of them, are being used to fight COVID, whether it's in diagnosing, whether it's in treating, or whether it's in follow up. Um, there are uh, several. I gave you example of just Israel, but the US and China have even more solutions. Each of them, Israel is about the third as far as the amount of companies available providing coronavirus solutions. So this talk was more centered on Israel solutions, but there are many different solutions out there, and depending on which specific problem you're or unmet need you're trying to solve, I can point you in the right direction. Okay, Israel, in the first wave, we were very good. Unfortunately, in this second wave or the continuation of the first wave, we're a little less good. But what Israel did to contain coronavirus, first they closed the borders fairly quickly. They created mandatory isolation for people coming in from overseas. They created mandatory isolation, 14-day isolation for people who were close to people who got infected. They used the mobile phone system to be able to track if you were close to a infected person, and basically uh, they put in a lockdown much quicker than most other countries, full lockdown. But then again, they released it, in my feeling, too quick because right now we're having a big surge of infections. Although the infections that are happening now are much less severe cases, meaning there are very few that are going into hospitalization and intubation, and there are very few deaths. So I don't know what that means as far as the infection is concerned, or as far as the control is concerned. But maybe we're just doing more tests now and finding more infected people. Israeli government is investing in AI heavily through incubators, through government-sponsored programs, through collaboration with other countries. Correct, most governments are not. I think that is a big mistake. That is a huge mistake because this is what's going to enable proper health care for all. This is a missionary cell to be able to convince most of the governments, but it's not something that the individual can control. This is something that has to come as example from other governments. Thank you. Yeah. Okay. Thank you.